Alright, so this is on Maine's overdose and the fentanyl epidemic. This is a PowerPoint I found from the University of Maine. Um, this is from 2021. I wasn't able to find anything newer. So the outline of this is what does the overdose data show? Why is this happening? And what is Maine doing about it? Drug drug deaths are increasing despite efforts by public health and public safety. In 2019, there was 380, which was only a 7% increase. In 2020, there was 515, a 36% increase. And then in 2021, 636, which is a 23% increase. The proportion of deaths due to fentanyl has also been increasing. So as you can see, it went from in 2020 336 to 490 for 2021. Fentanyl is extremely lethal, 25 times more potent than oxycodone, 50 to 100 times more potent than heroin, very fast acting. Fentanyl contamination frequently unknown to the user. Maine reflects national trends. Drug deaths are being driven by fentanyl lethality in Maine and nationally. It began in 2013, growth nearly exponential, recent mixing with cocaine and methamphetamine. Rise and fall of Maine drug death numbers mirrors national trends. So this is the first graph we come to. It shows the number of fentanyl deaths compared with the number of overall deaths. So the fentanyl deaths is the blue line. The red line is all drug deaths. You can kind of see how they're basically parallel. But the peak was in 2017, and then there was a dip, and then another rise in 2019. This next graph is the USA National Drug Involved Overdose Deaths number among all ages by gender from 1999 to 2019. So once again, we start very low, like under 20,000, and then up to 70,630. Once again, though, we see a little bit of a peak in 2017, and then a little bit of a dip in 2018, and a rise in 2019. Percent of drug deaths due to fentanyl. So this is just on the fentanyl percentage is increasing. So we're up to 77% in 2021. This one says age-adjusted drug overdose death rates by opioid category. So we've got a methadone line, opioids and other methadone stuff other than methadone, heroin, and then natural and synthetic opioids. Fentanyl supply. Fentanyl is a synthetic opioid manufactured in China and shipped to drug cartels in Mexico for distribution. Easier to manufacture than to grow heroin. Smaller amounts to ship because much smaller amounts are needed for the same opioid effect. Overdose deaths. Overdose deaths are not the best outcome measure of success or failure of state SUD programs, substance use disorder programs. Deaths are a biased sample of substance use disorder. Lethal drugs are overrepresented. Fentanyl supply rises and falls due largely to international drug trafficking. Additional fentanyl complications. Overdose death toxicology reports in Maine show that fentanyl is being mixed with other potent illicit drugs, especially. So we have a 49 46% with cocaine or methamphetamine, or both, 16% with pharmaceutical opioids, and 10% with xylene, which is new in 2021. This is a horse tranquilizer. Actually, it's gone up, I've heard, in recent, and the problem with this is even Narcan will not get you out of it if you have it mixed with other things. And usually it is. It's being mixed with other things. So fentanyl co-toxicants, drug supply spiked with fentanyl. And users may not even be aware of it. So we've got fentanyl and heroin, cocaine and fentanyl and methamphetamines. So you can see all the lines are, well, cocaine and meth are going up while heroin's actually going down. Fentanyl overdose. Accidental in the moment events due primarily to lethality. More toxic in smaller amounts, easy to be misjudged dosing. Faster acting, seconds frequently before they remove needle. Wooden chest syndrome, unique with fentanyl, can prevent resuscitation without inserting airway. Hidden as addictive in other types of drugs, users are often unaware. Users frequently using alone, isolation, discover and rescue attempts often too late, and need intermediate response with fentanyl. Nexalon may not be readily available. Pandemic has made this worse. Impacts of the pandemic on main overdose reported by providers who also distribute Nexalon. Reduce social supports. All those safety nets are gone. Increase psychological stressors. Stress tolerance is lower. Reduce treatment access and changing modalities. Treatment workforce is reduced. Marginalized populations don't have access to phones and computers for telehealth services. Isolation reduced. Opportunity for bystanders to save lives. Drug supply limitations. People taking more risky substances and may not be aware of the contamination. Public safety workforce is reduced. Interventions to prevent fatal overdoses. Keeping people alive until they get treatment. So we have Nexalon, which is the Narcan. Increasing supply of Nexalon in the community. Distributed to those who will be bystanders. So I know a lot of social workers now carry it. I have some in my purse. In 2021, Maine Nexalon Distributors Initiative distributed 77,480 doses between January and November. Get people into treatment. Just one example. Options program referred 263 and distributed 909 doses of Nexalon in their first program year. So what about other drugs? Most deaths induced by opioids, alone or in combination with other drugs. Medical examiner procedure in identifying casual substances. 258 accidental overdoses between January and June of 2021. 100% had one or more opioids listed as the cause, and 88 had fentanyl listed. So what about non-fatal overdoses? New in 2021, monthly overdose report, mainedrugdata.org. Deaths represented 7% of reported overdoses in 2021 through January through November. We saved 93% of overdose victims January through November of 2021. Reported non-fatal overdoses, 8,619. Suspected and confirmed fatal overdoses is 578. So January to November of 2021. This is a graph that shows the overdose type, number, and percentage. Sorry. New overdose review panel, LD 1718, established overdose review panel. 15 panelists examine individuals' history, make recommendations. Fatal and non-fatal overdose case review. Focus first on people recently discharged from jail or prison who died of overdose, using medical examiner file data and expanding from there. Police officer administers Narcan. Law enforcement participants in Narcan distribution and administration. In 2021, the Office of Attorney General distributed 5,384 doses of Narcan to law enforcement agencies and departments. Officers participated in saving 327 overdose victims in 2021. Law enforcement emergency response. In 2021 through October, law enforcement officers reported to ODMAP responses to 829 non-fatal overdoses, 386 emergency co-responses with options liaisons, 99 fatal overdoses. Law enforcement officers respond to the overwhelming majority of fatal overdoses. January to October, law enforcement without EMS is 89%, 89 or 17%. January to October, law enforcement with EMS is 398%. Nexalon and overdose death scene. The complexity of Nexalon administered among a medical examiner causes cases with EMS presence January to November. So 49% already deceased upon EMS's arrival. 36 have had Nexalon administered, up from 33% in 2020. 11% had Nexalon administered by bystander, up from 4% in 2020. Usually Nexalon was given also by EMS and often by police as well. Sometimes all three, bystanders, EMS, and police. What we don't know. Precise prevalence of substance use disorder in Maine. Best evidence is from National Survey of Drug Use and Health estimated 8.6% in 2019, approximately 116,000. Soon we will have more data from treatment admissions. Data about what drugs are being used among non-fatal overdoses or more generally by people who use drugs. We can assume that deaths are not a representative sample of drug use generally. This is another reason the drug death statistics are not a valid measure for evaluating effectiveness of substance use disorders, policies, and initiatives. Treatment data. Medicaid claims. So this is the substance associated with the claim. You can see alcohol, amphetamines is 0, cannabis, cocaine, hallucinogens, inhalants, nicotine, opioids, other stimulants, multiple psychoactive substances, and sedative hypnotic. Okay, fatal overdose data. All manners of death from January to June 2021. So we have opioids, 88%, fentanyl, 77%, methamphetamine, 26%, alcohol, 25%, cocaine, 23%, pharmaceutical opioids, 23%, and benzodiazepines, 14%. So, and then we have the question down here about what about other pharmaceuticals? So we have a summary. There are 4 primary reasons for increasing deaths. 1, fentanyl, toxic, fast-acting, wooden chest, hidden in supply, and very available. 2, isolation made worse by pandemic. People are using alone, but fentanyl users need instant response by bystanders with Nexalon, plus reduced stigma and more Nexalon availability in the community. 3, international drug trafficking, resistant to Maine policies. 4, workforce shortages, reducing Maine's treatment capacity and slowing our attempts to increase that capacity. So, news is not all bad. Maine has countered with strong Nexalon distribution and emergency response, saving lives 93% of the time.